Lab book options in Welford chart notes. Lab book options let you adjust the performance of the lab book. Let's see how they work. To use lab book options, from the main menu press System Lab Book Options, or inside the lab book press Utility Options. If you check Auto Add BMI, then whenever you record a height and a weight on a patient on the same date, the program automatically calculates the body mass index and records it in the lab book on that date. If you check Auto Fill in Normal Result and you are editing the lab book for a non-numeric test, if you set the abnormal field to normal and the result box is empty, then the result box is automatically filled in with the word normal. If you set the abnormal field to something other than normal and the result box contains only the word normal, then the result box is cleared so that you can type in something else. If you check Auto Fill in Normals, then after you specify the name of the test, the program automatically fills in the normal range for this test as stored in the range editor based on the patient's age and sex. If you check Auto Fill in Abnormal Description, then the program automatically sets the abnormal box based on the test result and the normal range as stored in the range editor. For example, if the result is slightly above the high normal limit, then the abnormal flag is automatically changed to slightly high. If you check Auto Lookup, then the program automatically shows you a list of tests that begin with the letters that you have typed after you type at least 2 letters. If you check Default to All Last Only, then when you open the lab book, it initially shows only the most recent result for each test that the patient has ever had recorded in the lab book. If you check Forbid Implausible Results, then if the result you are entering is higher than the high implausible value or lower than the low implausible value as recorded in the range editor, instead of being warned of this fact, you will be warned and then prevented from entering the result. This helps to reduce data entry errors. If you check Flexible Results and Units mode, then numeric tests are permitted to have numeric or textual results, and may have any units of measure. You should use this only under very unusual circumstances because it eliminates the possibility of graphing numeric tests if they have non-numeric results. If you check Page Up and Up Arrow Display earlier, then if you have highlighted the top line in the lab book, when you press Page Up, the lab book redisplays by setting the begin date backward month by month until it finds a previous result or has gone backward 3 months. And if you press Up Arrow, the lab book redisplays itself by setting the begin date backward week by week until it finds a previous result or has gone backward 1 month. Open Back determines how many weeks back the lab book opens by default. For example, 52 weeks means that it opens by default to show you the last year of entries. Set it to 255 if you wish to see just the results since the patient's last visit. Check Organize by Category to display the lab book with tests listed within their respective categories. For example, renal tests are grouped together. Then choose alphabetically to have the tests within each category grouped by test name. Choose chronologically to have the tests within each category listed chronologically. Uncheck Organize by Category to just see all the tests chronologically without any categories. If you check Show Only Main Names of Panels, then tests which have multiple components, such as electrolytes, will be displayed by default as showing only the name of the panel rather than listing its components. Right-click on the name of the panel to see its components. Right-click again to hide the components. Uncheck Show Only Main Names of Panels to show all the components by default. Check Show Last and Next Visit Dates to see the date of the patient's most recent visit and when the next visit is due when editing a lab book entry. If the patient is overdue for the next visit, the date appears in red. Check Warn if not active to see a warning if you are about to store a result on a patient whose activity in the name editor is not active. This helps you to avoid accidentally storing a result on a patient with a similar name who is no longer in the practice. If you want to focus your attention on just abnormal lab results, you can set Show Results with Abnormal flag to a setting above Any. The caption of the lab book changes to remind you that you are not seeing all of the tests. If you check Use New Growth Percentiles, the program uses height, weight, and head circumference percentiles from the CDC and the World Health Organization, which were revised in 2010. If you uncheck it, the program uses percentiles that were in force before then. You can choose whether tests with an abnormal flag of indeterminate are displayed in red or black. Press Automatic Renal Failure Diagnosis to specify which laboratory characteristics, when present, cause the program to automatically add a diagnosis of renal failure to the patient's diagnosis editor. This then allows the program to automatically warn you when you are about to prescribe a medication whose dose needs to be adjusted in patients with renal failure. Here we see the patient does not have a diagnosis of renal failure. We now record an elevated creatinine of 1.7. The program automatically checks to see if this patient's medications need to be adjusted. We jump to the diagnosis editor and see that renal failure has automatically been added. And that's how to use lab book options in Welford Chart Notes. For more information, visit us at emirj.com.